So it's National Nurses Week. That means extra love for our men and women on the front lines who care for us when we need them most.
They are the caretakers that take on so much responsibility in our communities, working countless hours, and during the pandemic, they were strapped even more. That caused burnout and depression among so many. So as we lift up our nurses, including my niece, Teresa Moran, we also remind them sometimes they need to be cared for also. And the support is out there if they need it.
That's right. Joining us now, Assistant Professor at Columbia School of Nursing, Dr. Letitia Hansen, also Michelle Charles, Letitia's student and nurse, and also will be graduating next week with her doctorate in psychiatric mental health. Congratulations.
Congratulations.
Clearly, you had a great professor to lead you along the way. Shout out to both of you.
Absolutely. And Professor, if I may start with you, nurses give a lot for their jobs. Obviously, we all know that. They sacrifice their own time for others. It's really just an amazing helping profession, working weekends and overnights and holidays. But, right, their mental health can be challenged, can suffer symptoms like burnout and depression. So is there a stigma within the nursing community against asking for help? Is there pressure to keep working?
I think as nurses, we feel the need to be there for our patients. And we feel the need that our patients are at times in their lives where they need us the most. So it's hard for us to seek the care that we need. But I talk to my students about recognizing when we're stressed. So thinking about when you're overwhelmed, when you're tired, when you start making mistakes, if you've noticed changes in your eating, changes in your sleeping. So first, recognizing that you need to get some help. And it's not just the nurses, there are other professions as well. But for nursing, we have seen an increase in burnout, an increase in depression, an increase in anxiety. So I think it's important for us to recognize when we need to get the help and then take action to reduce some of those issues that we're seeing.
And Michelle, how are you taking action? I mean, this is your specialty. This is what you're going to be doing, right, as you move forward. So how are you taking care of yourself and also other nurses around you where you may see that they do need help and maybe they're not asking for it?
Absolutely. So, I think the best way I take care of myself is connecting with my colleagues, making sure that we all know that we can go to each other for support. Professor Hansen actually does a really great job of connecting us together whenever she even anticipates that we might need support. So just being able to be there for each other, I think, is a really, really good way to, instill that self-care.
That is great advice, and I'll go back to teach. Professor Hansen, talk a little bit about what you tell students and what you tell nurses who are struggling. What tools do you want to pass on to them?
The first is that it's okay to ask for help, that recognize when you need the help, and it's okay to say that I need help. Kindness goes a long way, even to ourselves. So telling ourselves it's okay to make a mistake, being forgiving towards ourselves. But I first tell them, recognize when you're stressed, recognize when you need the help, and do actions, as Michelle mentioned, that will help reduce some of the stress that you're feeling to try to prevent it from getting to a level where we are in an acute state. If we handled our mental health the way we handle dentistry, we'd be a lot better off. Like, we don't wait until we have a cavity to go to the dentist. So I feel like being able to be there for ourselves and getting help right away is important.
Right, preventive maintenance, I mean, take it on, before it builds up and before it gets worse. And so, Michelle, I'm just curious, I've talked to a lot of nurses and that have been in nursing school and actually have decided to move into something else because they've been worried just about what happened, especially during the pandemic, right? And all the stress and the pressure. They heard horror stories. So what do you say to those who might be thinking about doing this or maybe have moved the other way, but you want them to come back? How do you encourage them to, hey, look, it's rewarding. Yes, it's demanding, but it's rewarding and you can do this and we need you?
Yes. Well, I always think about it this way. Whenever I'm, coming home from a shift or something and I'm thinking like, oh, I'm kind of tired, right? Like, this is good tired, right? Like, this is a good kind of tired to be where, I'm tired from going out there and feeling like I'm giving my best to my patients, right? And also, when I look at my cohort personally, a lot of us are doing exactly the opposite, right? A lot of us are second career nurses. So we're coming from other careers into nursing. So I think that just goes to show that, nursing really is a great and rewarding place to be.
That is a great, great argument, great truth. And we appreciate you guys so much. And my niece, Teresa, and all nurses out there, Professor Letitia Hansen, Michelle Charles. Thank you so much. Thanks to all nurses.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.